Stem cells, once you get them, whether they're your own or someone else's, only last about 10 to 14 days. But the benefits go on much longer. So why is that? Well, it turns out the stem cells that you get are delivering cell signaling to your cells, to your stem cells, to your regular factory cells, to your chondrocytes, to all the cells in your body. That signaling is done through even a smaller particle called an extracellular vesicle, or for short, exosome. And these exosomes became available 5-6 years ago, right when I was getting into this. And I learned a few things. I learned that exosomes are easier to handle and last longer. They penetrate tissue better. They don't get hung up in the heart and lungs like stem cells do if you get them intravenous. They pass the blood-brain barrier because they're so much smaller than cells. And they're the ones doing the work anyway. And wait, there's more. They're about half the price of stem cells. So I figured out that stem cells are really a delivery mechanism, and the exosomes were doing the work. Why not just skip the middleman and get the exosomes? So that's really what we're using now, and they come from the same donated source.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Jeff Gross, and we're going to be talking about the profound advancements which lie in the longevity and restorative healing potential of stem cells. Jeff has primarily been a spine and neck surgeon for many years, and to his credit, only 5% of his patients actually required surgery. He's always been somebody that has tried not to do surgery if it can be avoided. His rate now is less than 1% of his patients that require surgery because he is using stem cells and stem cell-derived exosomes, which you're going to find out about in this episode, and some of the other chronic diseases and conditions that can be mitigated by the use of stem cells and the various ways those can be administered. And it is really where medicine is heading, in my opinion. So Jeff Gross is really on the forefront of this stuff, and I think you're going to get a lot out of this episode. I know I did. So here he is. Let's get to it. This is Dr. Jeff Gross. Jeff, it's so great to have you on the show. I'm really happy to have you here. As we were just talking, we're on the forefront of new things in medicine, which comes up on this program a lot. And we're gonna talk about some of the things that you've discovered. You're a surgeon by training,
right? And
you have moved away from some of the more conventional types of surgeries in lieu of new technology. Let's call it biotechnology. Let's call it the forefront of where medicine is headed. This is why this is exciting to me, because folks, all this great stuff's happening. You know that. You wouldn't be listening to the program because you care about this as much as I do. I don't want somebody cutting into me when they don't have to.
And we don't want to, unless you absolutely have to have it.
Exactly. It's the last thing. Don't get surgery as a cure unless it's the absolute last thing. I do not like to be cut.
Agreed.
Who wants that? Okay, so tell me what happened. You went to medical school. You got this amazing training. You're an MD. You're a surgeon, and then you were performing surgeries, and you became, I'm going to say, disillusioned. Is that the right word?
I think that's fair, actually. Yeah.
All right. Tell us about this, because it's when you hear an MD say, my training only went so far and I've got a new way, you want to listen to that.
Yeah, it's a bit of a journey. So, I'm a spine fellowship trained neurological surgeon. Early in my career, I did brain trauma, brain tumors, spine problems, but I really love doing the spine, and it was my training and specialty to focus on that. So most of what I did in my career was neck and back pain and advice, and then if need be, surgery. And I probably had no more than 5% of my patients ever needed surgery by me, which I I'm kind of proud of.
Yeah.
Now I'm doing even less than 1%, because for what I learned to do was really, as a spine surgeon, two main things. When we got to surgery, it was either make more room for nerves or spinal cord or something called a decompression, or perform what's called a fusion surgery, where we lock a couple bones together that weren't meant to be together necessarily. And by the way, when we do fusion, sometimes we do decompressions also. And really, the on the menu were those two things, nothing else. Yeah, there might be a slight variation how we came at it, or how many levels we did, or what side we did, or what kind of hardware. And the hardware we're talking about metal screws and plates and rods and things, and there's a new widget, but really we're doing those things. And decompression is still, a very necessary thing in many cases, but the fusion was always seemed kind of barbaric, right? It's like before there were knee replacements, before the 1970s, really they were doing knee fusions for end stage knee degeneration. They would prevent someone from bending the knee if the pain was so severe they couldn't walk.
Mm.
So it always occurred to me that I was trained by professors who were 20 or 30 years my senior, and I was trained in the 1990s, just to be clear. Yeah. And they trained me to do these things, and they were trained by people 20, 30 years their senior, and really nothing had changed in those 40 to 60 years.
Wow.
And I've been in practice, 25 years. So we're talking about 65 to 85 years where really we're still doing the same stuff for the spine. And it just occurred to me that we can diagnose things faster and better than ever. We have MRIs. We can see inside the spine like nobody's business. And when this all started, fusions were done for the absolute worst patients that couldn't get out of bed. And now, sadly, you see people getting fusions who have a little bit of pain, and somewhere the apple cart was turned over, and we were seeing way too much surgery, and the outcomes were not as good, and something was not right and we wanted to look at that. So patients would also inspire me. Bob, they would come and say, "Hey, doc, we tried all the therapies, we tried the injections, we tried the anti-inflammatories. I'm still suffering pain. It's affecting my ability to exercise, but I'm not ready for surgery. I'm not that bad. I'm in this sort of gap." And, we're looking to fill that gap. And patients would come to me, "Hey, doc, how about lasers? How about this? How about stem cells?" And you hear stem cells enough. And instead of going to those, annual meetings we have to go to get our continuing education credit, where the same, ivory tower surgeon professors pat themselves on the back for doing the same thing for 85 years, I started going to different meetings. I finally took the leap and took a chance and started going to the regenerative medicine or the biotechnology meetings or the stem cell medicine meetings. And I got retrained. I got re-inspired. Of course, I had some undergraduate background in this, so it was chance favors the prepared mind. So I was a little bit prepared for it.
Yeah.
And I went to these meetings to have a new tool to fill that gap before surgery. And it turned into something much bigger than I ever expected. And that's where I am today.
I have a friend that came to getting stem cell treatment. He was listening to a podcast. This is how he found out about it. And it was a Joe Rogan podcast, and Mel Gibson was on the
Yeah.
podcast talking about his father getting stem cells.
Right.
And it was I can't remember the condition. I think it might have been a heart condition. I can't remember. So my friend went, I have this, or maybe this is something. And he looked into it, and he raised money, and he went down to Central America because it's not FDA approved yet here. Whatever he was getting,
we'll come back to that, I hope.
Yeah, we can. So and he went down there. And he had the treatment, and he's doing really well. And this is just kind of a funny aside. He was telling me, I think I've had him on the program. He was a rock and roll guitar player, so he was jumping on the stage a lot, and he screwed up his toes like really bad, arthritis. And he said they had some leftover stem cell from the heart thing, and they injected it into my toes, and they just started to uncurl.
Wow.
And he's like, that was a nice side effect. My feet don't hurt. So, I mean, that's skeletal. I mean, right there.
No, that's great. And I do a lot more than just musculoskeletal now. It's gone from the spine to the joints to so many other things. And it just makes sense biologically. And it is a technology of sorts, but that biotechnology you mentioned at the outset is really tapping back into our own body's natural abilities to heal, restore, and regenerate that we've always had.
Yeah, it's a fascinating thing to think that the answers are within us, and now we're coming to this sort of new way of looking at things where we can enhance that and make our bodies heal themselves, but with a little bit of a boost.
Yeah, we need a little help as we get older. Our cells, including our stem cells, which we maintain and benefit from, are exposed to the world, and the world has who knows what in our water, who knows what in our food, pesticides, chemicals, additives, who knows what in the air that we breathe. You're based in Los Angeles, it's cleaner than it's ever been, but man, 30 years ago, it was tough, right?
That's when I moved here. I moved here like 39 years ago, and it was brutal.
Yeah,
it was brutal. And then there's also, the EMFs from electronics and all the other waves that are bombarding our body. I was telling somebody, I think if a person from, let's say 150 years ago, you dropped them into, any city in the United States right now, they'd get sick from EMFs, just from EMFs. If nothing else made them sick, that would make them sick.
I mean, that's what the Europeans did to the native people here a few hundred years back, right? They were naturally healthy, and we came and brought them all kinds of bad things. So
it's the best way to take over a nation.
It's sadly true.
I'm laughing because it's a horrible thing that we were as a species kind of there naturally, and then and then went in a direction of what people like to call progress, and in some areas, yes, but not in that area.
Yeah, there's a price to pay for progress, that's for sure.
Yeah,
but all these pro-inflammatory forces on our cells, get gunked up as chronic inflammatory changes, and the cells are busy defending instead of being in operational mode, optimal mode. So that's really what even our own stem cells don't function as well as we age. And someone calls that, I didn't coin this term, but it's an awesome term, inflammaging. And our cells age by accumulating chronic inflammatory changes and chronic inflammatory behavior. And I mean, if you look at a lot of the longevity, things to do, they're called epigenetic. And those epigenetics influence what genes are being transcribed or utilized, and the longevity genes are the anti-inflammatory ones. So really, we're trying to slow and reverse inflammation on a chronic scale, because it does affect our cellular functions. It affects our stem cell functions. And if you look at most diseases of aging, they have an inflammatory component: cardiovascular disease, Alzheimer's disease, autoimmune problems, even type 2 diabetes. The pancreatic islet cells can have an inflammatory changes, and many others.
Well, yeah, they talk about whoever they are. I don't like to use the word they. It's being talked about a lot as lifestyle diseases, which are preventable or certainly can be lessened to an enormous degree
Yes.
by proper nutrition and exercise and meditation and all these pieces that I'm learning about over the last many decades that people can do. And it's being talked about in a certain community, of people that are interested in that stuff, but it really isn't in the general population to the degree that I think it needs to be so people can really thrive. When people come to you, do they know that this is what the kind of stuff you're doing, or they just they look in the yellow pages, if there is such a thing anymore, and they go, oh, here's a guy that could fix my back, and then they go in, they go, stem cells, what's that? Are people surprised?
Some people still come to me for second opinions for a spinal problem. I see a lot of people have already had surgery and didn't respond or didn't have the result that they were hoping for, and often they may not have needed that surgery in the first place. So I see a lot of failed surgeries. I see second opinions before surgery, people looking for non-surgical options. I love to talk to them. And now we have a new tool to add to the list, which is regenerative medicine. The other group of patients that see me now follow me for regenerative medicine reasons, whether they're biohacking, they're trying to stay young, or they want to reverse their biological age, or attack some disease, or slow some process, or prevent something. And I see a lot of joint pain and weekend warriors and athletes, pickleball players who don't want to have a knee replacement, something like that. So I have a hodgepodge of different things, different entry points, if you will, and I love it. I get to expand what I do and be kind of a doctor of many things, as opposed to the super specialist spine doctor, which I love the spine, but I like taking on new challenges, things that other doctors couldn't figure out, or you get the watered down Kool-Aid drinking insurance-based doctor who has 5 minutes and can't answer your questions.
Yeah, I'm fortunate in doing this show. I get to meet doctors that aren't like that are really caring people that want to give the appropriate amount of time and really give a holistic kind of approach to helping somebody. Give me an example, because I like little stories of, it doesn't have to be a specific person, but like a common issue that you would treat non-surgically and how you would do that. Like, I mean, you can get as detailed as you want. I think It's really interesting.
Well, I'll tell you, I think the low-hanging fruit is knee pain, not only because of the type of joint and the surface, but how frequent it is that we see this and how many people have problems with knees. And because the great literature to support the protocols and what we do have almost a 20-year follow-up out of Europe. So what we're doing is not brand new, like, oh, you thought of this great new idea. I'm following on the footsteps and standing on the shoulders of others who have tried different things in places where it was allowed 20 years ago. So we see a lot of the good research out of Asia and Europe. And as you mentioned earlier, there are a lot of clinics in Mexico and Central America where you can go. A lot of Americans go. But it's available here. But to remain compliant with the FDA, we can't advertise, we can't make marketing claims. So it's not as vocal here. But so you take a knee pain patient who's tried everything. They've had cortisone injections, they've had the lubrication type injections, they've had physical therapy, and then their doctor says you have arthritis, or if they're more complete, it's osteoarthritis, or they'll use the phrase bone on bone, which is sort of a vague generic term.
It's like chalk on a chalkboard when I hear that.
Exactly. And if they want to be doctor sounding and explain the process, it's called chondromalacia, which is a wearing away of the cartilage. Okay. So, and there are different stages of that. And the last stage, the worst stage, is that really your bone is basically touching bone. So they're right about bone on bone, but sometimes they call bone on bone too early. And the problem is the only thing they have for that is a joint replacement after all those other things failed. They have the same gap problem we have in the spine, where there's nothing between all these non-surgical treatments and a barbaric surgery with metallic hardware. So to fill that gap, an orthopedic surgeon in Paris by the name of Hernegau And if I mispronounce that, Professor, Hernagow, I'm sorry. My 3 years of high school French, it fell out of my brain when I moved to California in the 80s, and I had to learn Spanish. But he took patients who were recommended knee replacements, and he said, "Hey, instead of that surgery, would you like to join my study? We're going to use stem cells instead and see if you get better." So we had plenty of people sign up, right? That was a no-brainer. Half the people got an injection into the joint itself, like a cortisone shot, but instead it was stem cells. And the other half got injected into the bone layer just above and below the cartilage, called the subchondral bone. and he started tracking these patients, and they had great results in both groups. And every 5 years, he publishes how are they doing, the follow-up. And at 5 years, they were almost the same. And at 10 years, the bone group was doing better than the joint group. Some of those joint pain patients started to have problems again. And then at the 15-year, which he published a few years ago, they were significantly different. The joint group by then, only about 20-some% were still doing great. The bone group, it was 80-some%. So he clearly proved, and he's written why he thinks, and I agree with this, that your cartilage is made by the growth plates of the bone. Those are where the cells called chondrocytes are that make the cartilage proteins. Those are where the cells are that created that cartilage in the first place when you were creating your joint as a fetus and a young child. And during a young adult and maybe your first few decades of life, if you tweaked your joint or hurt a little bit, how you heal it by stimulating those cells. Well, those cells, including stem cells in the tip of those bones, they lose their gumption with age. They're adversely affected by those pro-inflammatory things in our world we mentioned earlier, and they don't function as well, and they lose the ability to restore that cartilage. Well, the whole point about injecting biologics back into that area re-stimulates that factory production of cartilage. So injecting into the joint, there's not a lot going on there. The joint is basically biological rubber. There are some cells, but not many. The cellular activity, the real biological party, is in the bone edges. And this is well demonstrated by that study. But still, in America, if you go to some of the stem cell clinics, and some are reputable and some are, questionable, most of them are still injecting the joint. They get some results, but the really longer lasting good results come from the bone edge injections. So back to what the stories are, I have wonderful examples in our clinic where we've injected biologics into the subchondral bone. We do it under a little sedation, because who wants a bone injection? That can hurt. So we use a facility, use X-ray guidance based on MRI targeting. We go right into the right spots. And within 8 to 12 months, we've repeated some MRIs just out of curiosity. We've seen restoration of the thickness of the cartilage surfaces. So we know that the body can regrow cartilage when it's encouraged to tap back into its history and cellular activity of a younger, more restorative person. So that's the entire basis of what we're doing.
I hope people are getting excited that are listening to this, because it's really an incredible thing to be able to do that. Where do the stem cells come from? Do they come from specific spots in the person's body, or do they come from, where do they come from?
Yeah, let's talk about that. So 20 years ago, stem cells were all the buzz, right? So stem cells can come from the person who's receiving them, called an autograft, because they come from the same person. They can be harvested from different tissues. Usually it's fat, or even better, bone marrow. Of course, that's another bone injection. And you take it there, and you can process it in some centrifuge and what have you, so you can pull out the right cells and growth factors and re-inject them. The other source of stem cells is the perinatal donor, and that means a mother is delivering her child by C-section. Congratulations, it's a boy, here you go. Oh, by the way, the placenta, the umbilical cord, the amniotic fluid, we were going to throw that away. Can we have it?
Recycling, come on.
Right. And hey, in some cultures, they cook and eat the placenta, or they make capsules out of it for health purposes. And it turns out, no wonder it's got some great stuff in it. It's got growth factors. It just made a baby. It's a factory. We still have the factory equipment. You want to use it. So they
Wow.
save it and they donate it. It's tested and screened in FDA certified, FDA compliant, ironically, labs that provide clinics like mine these products. But when I entered into this field about 6 years ago, there was some additional knowledge that had come along. And that knowledge is that stem cells, once you get them, whether they're your own or someone else's, only last about 10 to 14 days. But the benefits go on much longer. So why is that? Well, it turns out the stem cells that you get are delivering cell signaling to your cells, to your stem cells, to your regular factory cells, to your chondrocytes, to all the cells in your body. That signaling is done through even a smaller particle called an extracellular vesicle, or for short, exosome. And these exosomes became available 5-6 years ago, right when I was getting into this. And I learned a few things. I learned that exosomes are easier to handle and last longer. They penetrate tissue better. They don't get hung up in the heart and lungs like stem cells do if you get them intravenous. They pass the blood-brain barrier because they're so much smaller than cells. And they're the ones doing the work anyway. And wait, there's more. They're about half the price of stem cells. So I figured out that stem cells were really a delivery mechanism and the exosomes were doing the work. Why not just skip the middleman and get the exosomes? So that's really what we're using now. And they come from the same donated source. I don't even bother with autograft harvest from an individual because, Bob, when you take your car in to have the oil changed, you don't put the old oil back in. You want the young, freshest, cleanest stuff that hasn't been exposed to EMFs and pesticides and whatever's in the water.
Hey, this is brand new information for me, and I'm super excited about this. This is the first time I've heard about exosomes, and not that I study this stuff because I don't, but that's why you're here.
Happy to share. Yeah, so
yeah,
we're a big fan of exosomes, and they're a lot easier. I have a minus 30 centigrade freezer. We store them in here at the clinic. I've done some stem cell procedures, and I've used them on myself, and I can tell you that there's no difference in the outcome as far as I'm concerned in my own experience. But to store the stem cells, I have to use my minus 80 centigrade freezer. So they're really difficult to handle and store the cells. Plus, they cost so much more. Exosomes are really, I think, the more efficient way to get it done.
What's the range of things they can be used in? Are they specific to what you're doing with, let's just say knee replace instead of a knee replacement, or the spine? I know they're being used in other things. I had a friend that had, like I told you before, that had something. He had a congenital heart condition that stem cells helped him with that. Are they all the same stem cell? Is there a general stem cell injection that is a regenerative to the entire body? How does it sort of break down in the specific areas, or in a general way? Can I go in? I don't have a specific issue, let's say, which I don't think I do. So if I go, hey, I just want to feel younger, can I do that?
Yep. So I think there are two parts here. I need to break it up. The first part is, are these generic or are they specific biologics? And I can tell you that the stem cells and the stem cell derived exosomes that we use are generic. They are from what are called MSCs, or mesenchymal stromal cells, which are kind of the basic building block stem cell in our body. And the exosomes derived from them don't carry a specific message. They carry a generic message. And that message is through growth factors, proteins, and microRNAs naturally that stimulate a cell to stop creating inflammation and get busy doing what they're supposed to be doing, whether it's making cartilage or what have you. Now, I gave you the example of the cartilage because we do a lot of that. It's a common story, but these will affect your cells and stem cells anywhere. In a beneficial way to help reduce inflammation and improve healing, restoration, regeneration. However, There are designer ones coming. They're not available yet. And we have some that will be good for converting white fat to brown fat for weight loss, that will donate more mitochondria to muscle cells to improve muscle mass in an elderly, frail person, that are from immune cells that may have a role against cancer. All these are being looked at, and we hope to be on the cutting edge of being a place to make those available. They're not yet available in this country. The second part of your question is, what else can we do? So even with these generic biologics, we can, as you know, work on joints and spine problems, other sources of inflammatory-based pain. And I've treated many joints, ankles, hips, knees, shoulders, certain fingers with significant osteoarthritis, all kinds of things, TMJ, for example. And then we can also do intravenous treatments for people with inflammatory disease processes wanting to slow the inflammation, whether it's autoimmune, inflammatory bowel, thyroiditis, rheumatoid arthritis. These are all autoimmune, where the body's attacked. We want to kind of slow that process, hopefully without pharmaceuticals here. And then we do help people that have a recovery from an injury, whether it's traumatic brain injury, heart attack. The heart cells are inflamed after a heart attack, and there's great literature on this. This isn't just stuff we're making up or shooting out there. Everything we do is based on good literature that's available, good science. We've helped people recovering from stroke. Of course, the earlier we get to people when that inflammation is starting and their body is responding to a problem, the better. And then we have people with metabolic issues. They're having maybe renal failure, kidney failure. That means liver issues, insulin sensitivity issues. We've seen improvement across the board with IV. And some people come in preventatively. I call them the biohacking crowd, right? They want to slow their biological aging and reduce inflammation across the board. And I'm one of them now. I do the IV, every few months, just to keep things at suppressed, just keep the inflammation suppressed that we accumulate. So, and then we have some fun stuff, some cosmetic stuff we do, some microneedle facial, improve the skin quality. And think about it for a minute. You ever seen a pregnant woman, how aglow her skin is, and that because she is getting a dose of exosomes through the placental membrane to her bloodstream every day. And her skin is good, the hair is robust, she's, her body is just healthy. Usually don't have a lot of pain, except maybe back pain if they're carrying a lot of fluid. But generally speaking, pregnant women are super healthy, and good thing too, because they're the ones supporting the new life.
Yeah.
So if you want a little dose of that kind of love and that kind of health, an IV exosome periodically might be for you.
Well, it's really intriguing. So tell me now that you're doing this, I actually can talk to somebody that's doing this. How do you feel? What have you noticed about yourself? Is it subtle? Is it, what is it? Tell me, just your take on it with, obviously there's some sort of a predisposition to want it to be something even more than maybe what it is.
Right.
So if we take out the mental piece of it, if you can, as much as you can, what have you noticed? Just the way you feel and the way you're moving and all those things. Tell me about that.
Well, I'll give you the range of observations, including my own and others, because I ask everyone how you feel, right? So the first time, by the way, I've done this many times. The first time was the wow factor, and now I do it every few months, and I don't have as much of a change because I think I'm keeping it all the inflammation suppressed. Mm-hmm. But that first time, within an hour, I felt energetic and effervescent. My brain was clear. My libido was great. I slept wonderfully for weeks and weeks. I recovered from workouts quicker and better. I wasn't sore. I had my couple little aches and pains were gone. And then cognition, my brain was sort of ablaze with ideas, and I could get more done. And that for me lasts about 8 to 12 weeks. And then it starts to peter off a bit. And I'm 58. So, a younger person, it may last longer. We've given this to people in their 20s who just want that boost. they probably, when I hear from them, they don't have as much of a response. But I had one very athletic, healthy gentleman pushing 30 years old. And I called him the day after an IV and I said, "How do you feel?" He said, "I really don't feel much." But then about 6 hours later, he sent me a snapshot of his Whoop band. And you can track something called the HRV. I don't know if you've covered that in your show before, but it's heart rate variability. And you could do it on a Whoop band. The Apple Watch does it now. There are some other devices that can do it. And it's a very sensitive health metric. If you miss a night's sleep, you don't sleep well, it'll be off. If you have a few too many adult beverages, it'll be off. Like it'll tell you the day before you're going to get the flu. Like it knows. It's a very sensitive metric. And most people run in the 30s. He's an elite athlete. He runs in the 60s, which is incredible. He sent me a snapshot showing the trace of his HRV that went from 60s to 90s, which is crazy, amazing. That's 1%. So he said, "Yeah, I didn't feel much of a difference because I'm pretty healthy, but I saw it. I know it's doing something for my cells." And we can do blood markers too, before and after inflammatory tests if people want to. We can do biological age tests before and after, and see the improvements there. But the range is usually energy, sleep, recovery, aches and pains. Those are the big things.
Well, I'm not sure there's much else. It's like it's kind of everything.
That's fair. That's fair.
Wow. Yeah. I mean, this is amazing medicine. I think it's just absolutely incredible. Maybe this will be there eventually, that this is something people can go and do very readily. I'm sort of taken with the idea that a lot of this stuff was developed in other countries and permitted in other countries and encouraged in other countries. There is a belief, at least I had it. I don't know if I believed it, but I know that there was a belief that the United States is at the forefront of pretty much everything. And if it's not okay here, then it's voodoo and you shouldn't do it, and don't go to other countries because you're going to be in trouble, and it's not vetted, it's not researched. Apparently that isn't true, that there's a lot of amazing things that come from other countries. I know Germany has a lot of really cool stuff going on there, Switzerland. I didn't realize Japan. And, you always hear about Mexico. You go down there for, things that,
Right.
are unsavory, but not so.
Agreed. I think there's a lot going on in the world. The U.S. is held behind due to economic and political pressures. We all know the story about, the 75 to 100 mile per gallon carburetor that was, bought up and shuttled by the big oil companies. So this is what we're seeing here, right? Is people that sell knee and spine implants, people that sell drugs for diseases. It's going to hurt their businesses.
Oh, yeah.
To have natural biological improvements for problems. So they don't like it.
It's hard to patent things that grow in the ground and things that are natural. I don't think you can. Maybe there's processes you can get rights
Right.
to doing.
Right.
Wow. I'm very intrigued by all this. There's so many things that have been coming up on this show and in this space,
Right.
We were talking about something that we wanted to get into early on. You go, "I'd like to talk about that." I know what it was. It was medical schools, and what's and you kind of touched on it with the 80-year thing. But right now I have a daughter in medical school. I don't know what she's being taught specifically, because I don't go to school there. But I'm sure a lot of it is sort of what I would call conventional, down the middle of the road medicine. Very adequate, very good, I'm sure, at what she's learning, because she's, some of the things she tells me, she's just right on, like, with the knowledge part. But I asked her about, and she's sort of into the health realm herself, certainly with food and exercise. She understands that. But a lot of the students, and they're in their 20s, most of them, they're out of shape, they're stressed out. They're not into health foods. They're not into, and I'm like, what's going on over there?
Yeah. Yeah, it's med school is very busy and stressful, and residency is even worse. And let's look at it this way, Bob. When I finished my residency in 1999, I did 7 years. That included my internship, residency, and spine fellowship. someone told me a statistic. I went to a conference. A statistic was the average surgeon has a life expectancy of 68.
Yeah.
And I said, well, that's not right. Here I was, 34 years old, about to start my career at 34.
Yeah. So
I've
your
been
life's
busy
half
doing this.
over based on that.
Yeah, right.
That's the stat.
Exactly.
Yeah. Mhm.
So I said, that's not right. And so I had a little inkling of what would make me healthy and look into that. And it was nothing I learned in med school. We did not learn so many things. We did not learn the importance of restorative sleep. We did not learn about um, nutritional gaps requiring supplementation. We did not learn about, much about nutrition and diet. I mean, some. We did not learn about, you know, optimal nutrition. You look at the RDA, the vitamin C you need on the side of a cereal box, how much percent of the RDA, recommendation. That recommendation is to prevent malnutrition. It's not a recommendation for optimal nutrition, right? And these were first brought into play in the 20s and 30s, and during the Great Depression, when kids didn't have nourishment and they needed just the basics, not to get scurvy and rickets and what have you. Now we have abundant food, too much food, as you can tell by looking at most Americans. So what we're trying to now be optimal, and we really didn't get that training. What we got was, here's the disease, here's how to identify it, which is great. Here's the drug or surgery to fix it. And I'm sure it's improved. Like I said, I went to medical school in 1988 to 1992. I know there are schools that have integrative programs and bring in all kinds of things, but I never learned about chiropractic or naturopathy or probiotics and supplement. I didn't learn that, and I had to go learn that, which is not difficult, but I did as part of this whole movement here, so I could offer it to my patients. The importance of omega-3 supplementation and how much vitamin D and other roles in these things. We covered the vitamins briefly in medical school. So hopefully that's better now, and your daughter may be learning that. But my real worry is that once you kind of move from medical school into training and into practice, and the tail is wagging the dog, and that means the insurance companies, the payers, including the government payer, are dictating by rationing and other mechanisms, and I see this all day long, what gets covered. And doctors, out of ease of not to be, battered anymore, just go ahead and do the treatment that will get approved, not the treatment that might be best for that person. So, and why? Because it's all cookbook and scripted by some insurance company's approval algorithm. And the doctors are just a cog in that. They're not the decision makers anymore. That never sat well with me. And I have always been outside that, trying to fight it. And it's tough. It's an upstream battle. But I'm an out of the box thinker generally, and I'm looking to help patients who are looking for an out of the box solution.
Well, I appreciate that approach and the courage that it takes to do that, because it's not easy. You take a lot of arrows, I'm sure.
Oh, yeah.
I spoke with my primary care doctor, who I love. He's a wonderful guy, very conventionally trained guy, a little bit more open-minded than most. And I was asking him about the how it works. He's at a big, I'm just going to call it a corporation, but it's a hospital network. Let's put it that way.
It's a business. It's a business at the end of the day. Yeah, it's a corporation.
And I said, how does this work? He goes, well, everything's run by MBAs now. I go, what? He goes, there's no doctors at the top. He goes, very, very little. And like I said, I want to get, I asked him for a certain lab test, a couple of tests. And he goes, why do you want these tests? I said, well, I want information. He goes, well, what is it? He goes, all right, I'll order them. I don't know if they'll pay. And I go, okay, just order them. So, and then I read this great book, and it was all about lab work. I can't think of the doctor's name right now. I actually have it on my computer somewhere, but it's about what labs are, how they're how these ranges are determined. They're inconsistent all around the country. They're based on a certain population of people that, not let's say optimal health, that aren't sick.
Right.
basically. So the ranges are with people. All of a sudden, you're at I'll just pick any number. You're at 200, but if you hit 201, then you're considered sick. Then we can help you. Well, if I'm at 200, why aren't you helping me now before I get to
Right.
201?
Right. Right.
And I'm just picking a number. That's
No,
it's
and
too.
your number is actually on point because the high end of cholesterol now is 200, the high normal. 40 or 50 years ago, it was 240. And slowly they brought the number down so you could be abnormal easier so they could provide statins.
Oh, big
right?
money in the statins. Big money. I was recommended that by the readout based on my cholesterol, and I haven't taken them because I don't want to take them. And
Yeah.
and I'm fine. I don't have any heart issues as far as I know. Everything I've ever done has been fine.
Yeah.
Stellar. And
we are customers. We are customers of the healthcare system. We serve to make a health insurer make money. They take in more on premiums than they pay out on our care, and they have all the ways to do it. They have the lobbyists to make sure the laws are in their favor.
Oh.
And they dummy it down. They don't pay the doctors. The doctor is part of the service industry. They're not the respected earners they used to be. And it's a problem because these are some of the smartest people that get into medical school who are making the fewest decisions for your health. It's all scripted. They're really not making decisions for you.
Well, I have a call today with my doctor about some tests that I want to do, and I know it's going to be. And he's for me. He definitely is for me, but he has to ask why, and that's also responsible. But it's also, what is it?
I can explain. I can explain it, and it's important that people know this. So why he's asking you this? Because he knows he's going to walk into a hassle. He has no problem probably ordering the test you're interested in. But he's going to have to fill out paperwork. He's going to have to pay someone in his office and an extra employee to get on the phone and talk to a peer reviewer because they're going to make it difficult for that to get approved. And that requires him to not only see you, but use his employees' resources and time and money to get it done for you.
Yeah.
So at the end of the day, he's lost money seeing you. Whatever little bit of money they give him, whatever copay.
Yeah.
And I actually believe that one of the ways to fix Medicare is we just see those patients for free. Just at least for the office visits. We see them for free. It'll actually save us money. We lose money every time we charge Medicare for a patient. It's cheaper and easier just to see them for free. I've been doing that for 20 years. Now, surgeries and other things is different because that's a bigger expense. But
yeah.
I don't have extra people that call around. I don't deal with that nonsense. And I think a smart person would get the highest deductible catastrophic healthcare plan with the least premium, with an HSA component, a health savings account component, where they can control it. They're the insurance company for that first $6,000 or $8,000. And a lot of the people that see us for exosomes or something are usually using an HSA plan.
That's really interesting, because if we can revamp that whole system to be, effective, much more effective than it is, that would be wonderful. I don't know what the exact
United Healthcare profits by billions of dollars a quarter. And they don't do it by delivering healthcare. They do it by slowing it down.
Okay, on that cheery note.
You started it.
I did start it. I'm just talking about it. I mean, it's good information. People need to know this stuff. How can people get a hold of you, and what are we going to talk about here at the end so people can get excited about?
Oh, thank you. Yeah, so I love to meet new people and figure, work on challenging problems, and if I don't know the answer, I'll look into it. I'll do the homework. So patients teach me a lot. But the name for our regenerative medicine business is called ReCELLebrate because you're celebrating the renewal of your cells. So it's ReCELLebrate, and you can Google ReCELLebrate. My website will come up, or our Instagram or Facebook, and you can reach us through any of those. That's probably the easiest way.
There you go. And you're in Henderson, Nevada, Las Vegas, that area. So
Right.
if you're in that area, it makes it even easier. But I'm sure you
Right.
do conferences on the phone and all
We
kinds of
sure do.
things.
We do phone and televideo, and because a lot of patients, they may need, before we do anything regenerative, we want to make sure the rest of their body's optimized, because we don't want them to we want them to get the most out of a regenerative procedure. So if they're not on all the right vitamins and supplements, or getting restorative sleep, or exercising, what have you, we'll talk about it.
Very good. Well, thank you so much for your time. What a fantastic talk. I could do this another 3-4 hours, but we all have
Oh,
things
well,
to
let's
do.
do it again. Just leave me as phone a friend. I'll do it anytime.
Awesome. I appreciate that. Thank you so much, Jeff.
Nice to talk to you.
Much appreciation for you folks listening to The Exploding Human. If you'd like to visit my website, that is theexplodinghuman.com. You can also listen on YouTube, which is The Exploding Human with Bob Nickman. Once again, I want to thank Dr. Jeff Gross for being on the show. You can check out the website. It's called ReCELLebrate, with 2 L's in the word celebrate. Thank you so much for listening. Have a fantastic day. Thank you.